The Affordable Care Act requires that most Americans get health insurance coverage, and open enrollment for 2015 lasts until mid-February. But are people signing up? New Mexico in Focus producer Sarah Gustavus brought in some folks who are working in communities across our state to talk about enrollment this year.
I'm joined today by Joe Martinez, Outreach Coordinator with Health Action New Mexico. Thanks for being here.
Thank you.
And Eric Lujan, Program Manager for Health Education and Outreach with the Native American Professional Parent Resources. Eric's also a member of Taos Pueblo and Okewingbe. Thanks for being here, Eric.
Thank you.
Joe, start us off. This is the second year where the Affordable Care Act requires that people get insurance. And so where do we stand this year? Who's not signed up that you're looking for right now?
Well, first of all, all of the communities of New Mexico have many, many people who can benefit from health coverage under the Affordable Care Act, both programs, the exchange and the Medicaid expansion. And so many people are enrolling, but there's many people yet to be enrolled. And our thought is every community, every person in New Mexico deserves to have quality, affordable health coverage, and now's the time to get enrolled.
Do we have any numbers on how many people could get insurance through the exchange right now?
The exchange estimate is there's still about 160,000 persons that are eligible and could be enrolled. And so we're hoping everybody helps each other get enrolled in this period right now for the enrollment, open enrollment for the exchange, and for the continuing enrollment for Medicaid.
Eric, you're also a certified healthcare guide. What does that mean?
That means that I meet with consumers to help them go through the application, whether it's the federal facilitated marketplace application or it's Medicaid. So as a healthcare guide, or well, they will be called enrollment counselors this year, I sit with individuals and we walk through an application and determine what they may be eligible for, whether it's Medicaid or the exchange.
Now, if you're looking for people who aren't insured already, how do you find them?
So in our organization, we have two types of employees. We have enrollment counselors and we have outreach specialists. And it's the job of the outreach specialist to go out into the communities, go to places like laundromats, post offices, grocery stores, gas stations, and meet people on the street and provide them with information on the Affordable Care Act and what they may be eligible for. These individuals also are able to set appointments with our enrollment counselors throughout the state.
And you're specifically looking for Native Americans and Native families?
Well, our program is geared towards Native Americans. That's the contract that we have, but during the open enrollment, we help everybody.
And Native Americans are eligible to enroll anytime during the year, correct?
That's correct. Open enrollment is for Native Americans is year-round.
Joe, what's different about this year, about 2015? We are in open enrollment until February 15th. What are some lessons learned from last year that make things look a little different this year?
Most important, we're finding that it's the people-to-people approach, that people not attempt to get enrolled by themselves, that they seek out people that are experienced in helping others get enrolled. So one of the things that we're really hoping that people help each other get enrolled, use the experience they gained last year, but also to be able to say, I'm going to attempt it, I'm going to find somebody that can help me. If I have a problem, I'm not going to give up, I'm going to keep doing that. And across the state, all over in different communities of New Mexico, we're wanting to partner and we're wanting to team up people to make sure their family members and their neighbors get enrolled, but to do it on a people-to-people basis.
You know, this time last year, there was some skepticism and maybe some concerns, people not having enough information. Are you finding that's the same this year? People are still asking a lot of questions? There's
still a big objective, a big need to explain what the options are, both for the New Mexico exchange, but also for Medicaid. What does this entail? The basic understanding of the residents of New Mexico is still a very big objective, to help them understand and then help them see what their opportunities are to make a good choice in that. So there's still a big need for awareness and then motivation to get enrolled.
And we are a very rural state. Are you finding that the message and the approach is a little different when reaching out to rural communities for folks who might not be enrolled?
Well, what really works best is people-to-people, local people that might know how to do it, that have had a successful experience. We're a very bilingual community, not only Spanish, but the wonderful Native American languages, Vietnamese. We're a bilingual community, so that we really want to make sure that people who are helping others, that there is the bilingual capability as part of that. So it's a very big objective, but also we have many people of talent in New Mexico communities to help each other get enrolled.
Eric, did you want to add something?
Yes, in our work with Native American communities, we have found that it is families that are actually our biggest champions of outreach. Whenever one of our outreach workers is able to meet with a family member, especially maybe an elder, and educate them on what the importance of the Affordable Care Act, getting coverage, getting health insurance, we find that those elders are the ones that maybe pull their children in and their grandchildren, or they have they understand that there's a real need, and so they really push their younger generations to get covered.
Many Native folks have probably been going to Indian Health Service or IHS for a long time. What's different about talking with them about their options under the Affordable Care Act?
So we have a contract with IHS providers. Most of our enrollment counselors are part-time in IHS clinics, so Santa Fe Indian Hospital, Albuquerque Health Center, Acoma Laguna, Canyocito clinics. We have enrollment counselors in all of those facilities to help the IHS staff there, and then to help anybody that comes in the door. We also provided training for their benefits coordinators in those IHS facilities on enrollment in the ACA. And we also have a referral system. So if an individual goes into an IHS clinic and the clinic identifies them as eligible for the exchange, there's a referral process there that gets them to one of our enrollment counselors to do enrollment.
But what would be the benefit for the average person in signing up for the exchange if they already have coverage through IHS? So we get that question a lot. The benefit for the individual Native American consumer to get outside coverage other than IHS is greater access to care. For those people that don't know how IHS is funding, they have a limited amount of funding for services that are provided outside of IHS, and this is referred to as purchase referral care. Obtaining Medicaid or insurance through the Affordable Care Act allows you greater access to services outside of IHS, and that's why we encourage people to take advantage of it, because for a lot of Native Americans, you need a referral for services outside of IHS, and if there's no funding for those services, then you're out of luck until funding is available. So having insurance, having Medicaid, having a private insurance plan allows you to go see the doctor without having to wait. And Joe, do you want to say something?
I was going to add that one other role, the churches have a big role that they can play in encouraging their parishioners to get enrolled. And our organizations are very willing to come and help enroll. It's people coming together. Churches have a big role to play. Schools also are getting very active in doing outreach, making sure all the parents are enrolled, not only their children, but they themselves as parents being enrolled in health coverage. So those are other opportunities. I was also going to say that the New Mexico Health Insurance Exchange, their board, has been very positive and very proactive to say we need everyone that's eligible to get enrolled from the very beginning, and that continues, that all of us working together, we can see that individuals that are eligible get enrolled for either the exchange programs or for the Medicaid programs.
And we all know that our state has really high rates of poverty. We're one of the poorest states in the nation. And for families, that might mean that purchasing insurance or spending even a little bit of money could be a challenge. How do you talk to people about the financial burden or the options that they have to get the most affordable care possible?
One of the big factors in the approach, the community-based approach, is the idea of health literacy, that individuals will sacrifice so much for their children to get medical or dental care. Individuals may forego as parents, but at the time comes that an individual will say, you know, we need to do this so that it's not a crisis all the time. And so looking at that, health literacy includes family budgeting, making sure that that's doable. But the wonderful thing is the idea that once a family is covered with health coverage, that burden, that fear of what happens if someone gets seriously ill goes away. And that's one of the benefits of this whole approach, is that once covered, people are reassured that their children and they, as parents, are going to get covered, and individuals will be covered with health care.
And the New Mexico Health Insurance Exchange has been around for a year. What are you hearing about people about their premiums, what they're paying each month for health coverage?
We've been very positively surprised that they've been very reasonable. They've been, people have been surprised that these are, this is just, there's a competitive factor, and what is most important is that this is quality health care, and it's been affordable. It's for New Mexico, it stands out as one of the more affordable places to get health coverage.
Eric?
In dealing with consumers in health insurance and just comparing from last year to this year, we have seen a drop in health premiums. A lot of people coming in they receive a letter from their insurance carrier. It's their renewal letter. They want to know if it's something they need to do. In my experience, I've seen an overall drop in health insurance premiums. And there was an article about a month ago that stated that in New Mexico, health insurance premiums have overall dropped 11.8%. So the insurance costs, monthly costs, are coming down in the state.
Let's talk a little bit more about renewals. It's not just people signing up this year. Right. Remind us, what happens if someone signed up already and at the end of the open enrollment period they enrolled again?
So what happens for those individuals is they should get a letter from their current insurance company outlining that they had insurance and providing a number so that they can add it to their taxes to show that they had coverage for 2014. And then also there'll be a statement saying, well, this is what you were paying for in 2014. Your estimated cost is going to be this cost for next year, and you'll be able to see if it's gone up or gone down. And it gives you the option to, if it's gone up, to go to a different plan, and if it stayed the same, then you can continue on with that plan, and that renewal process is automatic. So if you just want to continue with the plan you've had before, you don't have to do anything, and you'll just be re-enrolled into that same plan.
That's a big objective now that many people have been enrolled in the Medicaid expansion. They also need to recertify on the anniversary date of their being officially on board on Medicaid expansion. They will need to be recertified. That will also be directly communicated to them by their health provider and by the state. But it's always good that an individual make sure that on their anniversary date that they are recertified so that their coverage continues for Medicaid. And so we are constantly reminding, renew, recertify, make sure. To us, the most important facet of this healthcare opportunity is to get enrolled, to use it, and to keep it. And recertifying and renewing is such an important part of that. So every family needs to do that. Every individual needs to make sure that they're in charge of keeping it and making sure that they use it. And it's a wonderful opportunity. Everybody benefits by having health coverage for more people in New Mexico.
Now, I know both of you are very supportive and passionate about the exchange and about these options for people. It's hard to forget, though, that there was a lot of controversy when this was first passed. Are you hearing from people now, any people critical of the plan? Sometimes people call it Obamacare. Sometimes there's some politics in there. How do you respond when you run into those conversations in the community? Eric?
So as an enrollment counselor, we do see that a lot. People come in that maybe don't qualify for financial assistance and never had insurance before, look at the cost and say, oh my gosh, I can't afford that. That does happen. It's our job as an enrollment counselor to counsel them the best that we can, get them into programs that they can afford. But also there are a number of hardship exemptions out there. So if you really can't afford health insurance coverage and you don't qualify for Medicaid, come see an enrollment counselor, because we can help you look to see if you're eligible for a hardship waiver, which means you won't have to pay a tax penalty.
But are you hearing any negativity, any people saying I shouldn't be having to do this in the first place?
We do get some pushback from Native American communities. We have a federal obligation to provide health coverage. What I say to them is this is just an extension of that federal obligation. For Native Americans, there's a lot of incentives built into the Affordable Care Act to get health coverage. If you're a Native American, member of a federally recognized tribe, and you are under 300% of the federal poverty level, then you do not have to pay any cost sharing or co-payments or deductibles when you get a plan through the exchange. So your only cost is going to be that premium amount.
What's an example of 300% above the poverty level?
Ooh, off the top of my head, it depends because it's on a sliding scale and depending on how many individuals live in the household. For a single individual, I believe it's around $2,800 a month. Okay, that might be a little high, but it's somewhere in there. So even if you're making a sizable amount of money, you might still be eligible for cost sharing reductions and federal assistance.
We tackled that question. It was a good question. Occasionally there'll be someone that's just totally against this concept. And what we've learned is that to us, health coverage is personal. That a person deserves to have adequate, quality, affordable health coverage. And so we keep it at that level. We say healthcare to us is not political. It's personal for individuals, for families to be covered with health coverage that now in New Mexico, it's an incredible opportunity that our governor passed and approved that we have Medicaid expansion, we have the New Mexico Health Insurance Exchange under wonderful leadership, all of those working to make sure that everyone gets health coverage that is eligible for that. And to us, it's an opportunity. So we kind of step back and say, you know, there'll be individuals, a limited level of understanding of how it works, but there's so many that want it, and that's where we're focusing on.
What more do you think could be done to address, we have a lot of health needs in this state, but specifically making sure that people have adequate coverage and they have access to care? What needs to be done next to extend the work that's already been done on this issue?
That is the next step, is making sure that we have access to providers, both in Albuquerque and in rural areas. Just in terms of the Indian Health Service, I can tell you it's already making a dramatic change, because as I mentioned before, the purchase referral care budgets, there's only a certain amount of care that they can provide. IHS is able to get third-party reimbursements from Medicaid and from private insurance, and with that money they use it to extend that care even more. So prior to the Affordable Care Act, IHS was only paying for what they called Priority 1 cases, which means you'd have to be in serious health disparity, you'd be in danger of losing life or a limb. Okay, that would be the only time they would pay for services outside of IHS. Well, now we're looking at IHS service units paying for Priority 3 and Priority 4 cases, which are simple things like x-ray services and prescription drugs, as well as like eye treatments, glasses, things like that, that haven't been really paid for quite a while.
And I think the other aspect is that it's a new experience. It's a new system to implement health coverage for so many, in all communities of New Mexico. We need to continue to work together to make those systems work. We need to really make sure that the state is doing its best to interact in terms of the exchange and the Medicaid outreach efforts, that the systems are working to the benefit of all New Mexicans. And the other aspect is that we also need to look at resources that can be engaged in helping this effort. We have an incredible network of promotoras, community health workers, incredible knowledge and respect in all our cultural communities. They need to be more involved in helping, teamed up, and we need to make it work, to say there's an incredible partnership to make sure that everyone who's eligible for health coverage is enrolled, is supported to use their system and to keep their health coverage.
And we'll be following what happens next after February 15th when open enrollment ends. Thank you to both of you for joining us today.
Thank you.
Thank you very much.